So what's your read? We're in April 2025. What's your read on the state of global health today?
I think global health is in a period of major disruption, which can be both very negative, but could also lead to some changes that many people have been asking for without knowing exactly the direction it should go into. We can all be very negative about it. We can all feel very bad about it and worried. But I think what we must actually do is look forward and say, what would another global health system look like?
And how can we do that? How are we going to do this whole process of looking forward?
Well, first we have to be honest. We have to be honest about ourselves, because if I speak sort of the global health community, whoever that is, but we have to be honest of what we just continued to do, because also it was easy to do. There was lots of money around, there were clear actors, and we just did what we always did, but more of it. And so I think what we must do is really reassess what are the key action areas that global health must actually take into account at this very, very historic point in time. We must add the experiences of the COVID pandemic. We learned a lot there.
What did we learn?
Well, we learned, for example, how important supply chains are. We learned how important it is that there are production sites in developing countries. We learned that there wasn't enough investment in capacity in developing countries, and not only in capacity of healthcare personnel, but researchers, epidemiologists, those kinds of people, regulators. So we actually saw a whole range of major gaps. We saw that we didn't have an understanding of what international solidarity in health really is. How do we share vaccines? We didn't have a system for that. So I think we can actually identify a whole range of gaps, and at the same time we can see that a whole range of colleagues in developing countries, in Africa in particular, have already for a longer period of time said, look, we want a different system. We want a system which makes us independent. We want a system that actually puts pressure on our governments to invest in health so that they can't rely on the streams of development assistance and not take health as seriously as they should as a resource for our countries. So these things, I believe, must come together.
COVID was a moment, I think, where we all experienced in different ways, and we are still experiencing a breakdown in trust. Do you think that there is enough trust left in the system now between the global north and the global south to move forward?
I don't think there's trust to move forward in the old way. For me, the old way is, here's overseas development assistance, here's a whole bunch of money from whoever, and the others, those with the money define the priorities, those with the money define the metrics, those with the money define what is classified as success. I don't think there's any trust for that. But there is a readiness very clearly to move forward if there is real investment. If the head of the Africa CDC says, what we want is production sites, and says, look, there is an enormous market here for vaccines, but we want to produce them. Help us produce them. And that can be with private, probably must be with private investment. But then, who helps us set the rules? How can we do that in a way that really brings us forward? And who should the partners be? And here we see that the partners is not, as perhaps in the donor world, the old West, but is going to be a whole number of countries from Asia who are ready to invest, who want new types of partnerships. So we're going to see shifts of a different nature that will take us forward. But the trust, you can see it in the pandemic negotiations for the treaty. The trust is not there because obviously, as is in all crisis situations, countries say, it's me first. And of course, to a certain extent, countries have a responsibility constitutionally to take care of their own populations first. So you can't also only blame the West, but you've got to say, you've got to make it possible for other countries, for poorer countries, for developing countries, to also seriously take care of their populations and not be so dependent.
So what do you think would be the most promising avenues for rebuilding trust? You mentioned taking seriously requests or demands to develop manufacturing and research capacity in the global south. Are there any other?
Well, I really think those are central, but there's so much around that, in terms of different types of health diplomacy, different types of exchanges, the kinds of things the center here is also involved with in educating professionals, in exchanging people, in running programs together. The attempts now of the European Union to work with the African Union at the same level in moving agendas forward. But what we're experiencing now is exactly what's so often said. It takes years, sometimes decades, to build trust, and you lose it in 10 minutes. And therefore, we're again at a real starting point. And a lot of that will be geopolitical. Which countries come together in which constellations in order to move forward. And of course, there one then sees constellations of which are more regional, for example, because there is more trust within the region in some cases, not everyone of every region, of course. But I think the situation also of a divided West now, it used to be there's the global North, there's the global South. Well, the global South isn't one. And what we now know very clearly, the global North and the West isn't one.
Splintered.
It's all splintered. And that leads to, I would say, a lot of experiments also. Whom can I trust? Who can I work with? Who won't exploit my situation? But I think that won't happen overnight.
It's interesting you brought up health diplomacy, and you've been the founder of global health diplomacy in another era where global health diplomacy was really operant within a sort of a multilateral system, treaties, the WHO, etc. What is the global health diplomacy of tomorrow going to look at, given the situation we're facing?
Well, at least at present, it's much more transactional. It's really coming together based on national or regional interest, and also to express that clearly. I think maybe in the past a lot of that was also there, but one spoke of global public goods and all kinds of things. But yes, one moved in a system that was staid, and nobody really wanted to shake it up. I think people right now also in health diplomacy are willing to be more controversial and we also see that health diplomacy can become very loud and unpleasant. I've sat in meetings where both Ukraine and Russia were present, and but the venues therefore are even more important. If there is so much uneasiness, unrest, lack of trust between countries, a priority.
There needs to be more diplomacy, no?
Absolutely, that's what I'm trying to say. It needs more diplomacy. People forget, why do we have diplomacy in the first place? Not because we all agree, but because we disagree and try to reach some kind of agreement.
So I think this is really important because I think that there was complacency is too strong a word, but there was a certain bureaucratization of global health diplomacy.
Yes.
And now we're at something which is much more, could one say, entrepreneurial? How would you describe if the old?
It's much more, it's more interest-led. And the interests, people don't shy putting their interest on the table anymore. It's more interest-led. There is more conflict, and the conflict's also put on the table. And of course, I wouldn't say entrepreneurial, I would say transactional. I'll give you this, you give me that, and maybe then, But in that sense, it's doing what diplomacy always did.
Yes.
I'm reading a book on Metternich right now, on the Vienna Congress. And, they were all at war with each other. And then, they had to sit in a room and they didn't agree, and it took them 2 years. But they found a peace solution for Europe. And I think because of this period that you spoke about, people have forgotten that diplomacy actually is especially necessary if you don't agree.
So what you're saying, I think, is very important, that we've entered an era where, rather than being a terrain of imagined, perhaps, consensus and collaboration, global health has become a terrain of competition and conflict. And that's why we need diplomacy more than ever. Is that a fair statement?
I agree with you. You see, because in previous days, if we call it that, the notion was if the world doesn't agree on anything, it will always agree on health because everyone wants health. And now we see, no, this isn't the case, because health is also interest-led. And in many ways, it can be interest-led in terms of, I'm just protecting my population, you go away. But also in the other areas we've mentioned, health is an enormous business. Health data are an enormous business. Can I protect my health sovereignty? Can I protect my data? Health is all about innovation and research, and one of the largest competitions worldwide is, who is the most innovative country? Who will attract pharmaceutical industries? Who owns the tech industry that has access to all these health data? So it's all about trade, but also innovation, geopolitics. And this is the area around which we need to construct the new global health diplomacy, because they all interface. And just like science diplomacy, remember in the past it was, we don't get along with Cuba, but our scientists go to Cuba and we talk. And so what was that? Two-track diplomacy or something like that. But now science diplomacy is heavily geopolitical. Nobody wants to share their science results anymore. And we see that you now see with scientists wanting to leave the United States and going to Canada and Europe. So some of the premises we've worked with, well, academics can always talk to each other and health people can always talk to each other.
Less and less. Yeah.
It's over.
So what would a future global health diplomat, what should they be good at? What skills and what knowledge do you think they need in this new world?
Well, funnily enough, it's a lot of the skills diplomats have always needed. We've always encouraged people to really, really understand and read the situation. And and actually that has become more complex because
the geopolitical situation, or also maybe personalities in a room as well.
Well, personalities are always important, but I think the understanding of the complexity of health now is something that's really very important, and seeing that the minute you talk health, you're talking science, you're talking trade, you're talking supply chains, you're talking investments, you're talking a whole range of very different competitive transactional areas. And trying, if you say, well, with health diplomacy, we actually want to create something that benefits all countries, not just one country, trying to come to that core, which is so difficult now in the pandemic negotiations, and being able to not only take but also to give, finding a consensus and building alliances. Building alliances is much more complex on the one hand, much more challenging, but on the other hand, of course, opens totally new avenues. And we're seeing new countries who are not that aligned with spheres of influence playing much more important roles.
So today's global health diplomat can't rely on an existing kind of architecture of alliances and ways of getting things done. So they have to negotiate a very complex, fragmented, and conflictual world.
Absolutely. And, some countries are consciously positioning themselves as the diplomatic entrepreneurs who help countries.
The go-betweens.
Actually, yes, the go-betweens. And, India is very clearly playing that role.
How important is we've heard about the importance now of geopolitics to global health, and I think everyone can understand that. How important is global health to geopolitics?
Not as important as we thought at first instance. It is, though, important for geopolitical interests if we take these other areas we've already mentioned. Because
meaning
the supply chains, I think it's absolutely critical. Think of Greenland, think of the minerals and the applications you need for pharmaceutical industry. So it's a new picture. We're only just now piecing together. I think it's less important right now for this notion of soft power, even though, the new paper by the American administration putting forward this new humanitarian agency speaks of soft power again, actually nearly surprisingly. But
a bit late for that.
Yeah, I think, health diplomacy at present will be more driven by hard power, by security concerns, a certain securitization, also of science, and so in that sense, depending where you want to position yourself geopolitically and how safe you want to be, certain areas of global health and investing in them will be quite important. How do I ensure my supply chain should there be a pandemic.
So the global health diplomat of tomorrow has to be, in French we say polyvalent, has to master these different areas, right? Supply chain, tech.
Yeah.
And
in the past it was humanitarian assistance, you had to know about AIDS, those kind of things.
And now you have to know about those things. How is it a good time to study global health?
I think it's more exciting than ever, quite honestly, because, I'm a political scientist, so I've always said health is political and global health in particular is political. And I was always, a bit unhappy when people pushed global health so much into the purely development and humanitarian arena. Sort of saying, there's other things going on. And of course, with globalization, yes, health already started to be a big industry and a competitive part of what was happening, but it didn't play, that amount of role as it does now. So I think anybody that's interested in change and in influencing change through diplomacy and through action in those related areas should be really, really excited, because this is a time where we shape the global health of tomorrow.
Great quote. Why study the global health in Geneva? Is Geneva dying as a center for global health?
Well, that we don't know, because obviously what I do think will happen, there will be less agencies in Geneva. They will be poorer. And they will need to work together more, otherwise they won't survive. But I definitely think Geneva will continue to be a center of global health and of health diplomacy, obviously, as long as the WHO is here. And that means the link also into other organizations that are here, even though the future of the World Trade Organization is not that clear either at this point in time. But I do think being where a lot of health diplomacy happens, whether it's called health diplomacy, whether everyone understands that they're doing health diplomacy at this point, human rights negotiations also apply to that, of course. So it's a good place. It's a good place to study it, to feel it, by being in the organizations. But of course, also, if one is an institution like the Global Health Center, having access to people who have to live it every day, either the diplomats or the people who work in the organizations, is a benefit you don't have even if you're in one of the best universities wherever, but having that day-to-day access, I think is just an unbelievable opportunity. I mean, just going into the cafeteria of the World Health Organization and even having the ability to just go up to somebody and talk to them, learn from them, and get some insights.
So to come back to the intersection between global health and security and geopolitics and hard power, with something that's become, I think, clearer over the last few years is that through the question of attacks on healthcare and weaponization and so on, is that health appears to be increasingly used as a tool of war. What do you think? Is that so? Specifically, degrading population health as an objective of bombings in Ukraine, Gaza, and so on. So that somehow using a population's health needs and health infrastructure against them has become a tool of war. Is that something you would? What do you think? Would you endorse that?
Well, I think first of all, wars have become more brutal, and the rules of war don't apply anymore. At least, from what we see right now. I mean, on the other hand, we mustn't forget that for women, this was always the case.
Mm-hmm.
That, you know, wars over the last 50 years have always been, you know, on the backs of women and raping and whatever. But what has happened, of course, in the last, particularly the last 5 years or so, is the very conscious attack on healthcare infrastructure and on sick and vulnerable populations, and that is, you know, the whole destruction of a rules-based system in its widest sense, that we don't respect as a global society the rules of war anymore. And we see it in Ukraine, we see it in Gaza, we've seen it in other places that people don't talk so much about, Sudan. In Sahel, Sudan. You know, it's been there for longer, but for people in our part of the world, it's become most obvious through these two wars, and therefore there is, you know, an enormous need for more ability of humanitarian responses, as we call them, but they are just not sufficient. It's really about destroying populations, about destroying nations and people. It's no longer a war of militaries, and this is, of course, something that needs to be addressed at a much, much higher level. But it should also be more openly discussed in the World Health Organization than it is presently.